2, lining up the sound. Hey everyone, this is Dr. West and Larry. I'm really excited to share with you his story about getting his health back, because we nudged him a little bit, but he's done a ton of work on his own. And as we were doing the interview today, I'm like, hey Larry, is it okay to share the story? And he's like, well, you interviewed me once. I'm like, yeah, but we're way better. I got the sound right, got some lighting, some other things. So Larry, when you first came in, I mean, it's been 10 or 11 years, I think.
About nine years.
Mm-hmm. 9 years. And there was some serious stuff when you first came in. Sarcoidosis, lymphoid cancer, chronic diarrhea. What else?
Lymphatic cancer.
Lymphatic cancer.
Yeah, lymphatic cancer. They thought I had at least third stage.
Third stage lymphatic cancer.
Yeah.
And then there's some other things happening in your skin. What was that?
Oh, I had boils. I had for years and years and years. I had chronic diarrhea. My health was just overall failing. When I came in, I had kidney function problems, minor liver function problems. I just did not feel good. My joints all ached in my body. They just, every morning I'd have to ratchet my hands open because everything was just, it was not good.
And the other thing that happened was you were carrying around some extra stored energy, right?
A little bit.
Okay. And so I was asking about it. He said, I've lost some weight. And I said, how did you do that? And he said, well, I started hiking. I started, doing some things. So obviously that's not something we did in the office. I'm just really proud of you that you did that. And then you said something that was really important. How do you feel now?
Feel great. Best I felt in 25 years.
Okay. So the reason why I wanted to share with the story is you're not your diagnosis, even serious things like that, because if you take control of your health and you line up with someone that really, really helps with a functional medicine perspective, this is the outcomes that you get. So, Larry, let's kind of walk through, like, what are the treatments and stuff that we've done?
Well, we did IV therapy for the Lyme, and immediately within 2 to 3 visits, I came once a week, 2 to 3 visits, I started noticing a difference. I started noticing my lymph nodes started actually going down, and they were growing at a really fast rate before that time.
And then the medical diagnosis for that, what do they tell you to do for the lymph nodes before you came here?
Nothing.
Yeah, so just wait and see what happens.
Yeah, maybe, well, they wanted to put me on prednisone, and I wasn't going to do that, so.
And then the other thing is you were sensitive to the sun?
Yeah, that was later. That was later on. That was 2 or 3 or 4 years later. And we found out that my calcium level in my blood was way off, and vitamin F was way off.
So people don't hear very much about vitamin F or vitamin G, vitamin P, vitamin T, but if you have too little vitamin F, what happens is you get sun hypersensitivity, or you get a reaction to that.
Hives.
You got hives. And so it's too much acidity, it's calcium in the wrong place. It's a really neat trick that my dad taught me. You saw my dad before he passed away. He nudged you in the right way. We saw your blood tests today. They look really good. Some other things that we did the vitamin infusions. We did the medical nutritional therapy, and we nudged your body back in the right way. You started doing your things. It's just an awesome outcome. Chronic disease is treatable, and here you're hearing someone 10 years later doing better than they felt in 25 years, because when you line up the body right, really good things happen. Larry, did I miss anything?
There's a lot of things that I had. A lot of, over the years, I had a lot of problems, but I just thought I was just getting older. And I had, oh heavens, blood clots. I started having blood clots in 2004. I had a pulmonary embolism that should have killed me. And since that time, between 2004 and when we started getting treated for Lyme, I had blood clots in my calves virtually all the time. And ever since I got treated, no blood clots at all.
So balancing out the body chemistry. And Larry, something that's really interesting. You got the diagnosis of sarcoidosis, lymph node cancer, all these intestinal problems, stomach problems, and we found the root of it was Lyme. We treated the Lyme, and everything cleared up.
Everything cleared up.
And do you remember having a tick exposure? Did you have a tick bite?
No, but I remember in '94 I got bit by a flying ant, which and it didn't create the bullseye, but it created on my neck right here. It created a lump that stayed with me for about 4 to 5 months, and that's the only thing I can think. I know it's normally ticks, but I was exposed to ticks my whole life when I was a young boy.
Sure.
And
then you also sent up one of your relatives, Vicky, and I don't want to use her last name because I want, but she's had a really good outcome too. What was her?
Extreme joint pain. She had a lot of the same things that I had. Just you just didn't feel good. Her husband complained to me. We went on a camping trip together, and her husband complained that he couldn't hug her anymore because she hurt. And she did a lot of work with her hands as far as crocheting and needlepoint. She couldn't do any of that. She almost couldn't do anything.
And how's she doing now?
She's doing great.
Yeah. So this is what happens when you get healthy. You want to share it with others, which is exactly why I wanted to interview Larry, because it's so fun to be in the healthcare space when you're making consistent changes. Larry, is it okay if I share this story of hope with others?
Sure.
All right. So Dr. West and Larry on treating chronic disease. You're not your diagnosis. There's always hope. We'll see you guys on the next Medical Miracle video.